Hello, everyone. Today, I want to speak to those of you out there who are currently struggling with addiction, as well as to the families of you out there who are currently battling this challenge. If there were one question that each of you could ask and get the answer to today, I'm pretty sure that I know that what that question would be, and I'm going to help you answer it. Be sure to watch until the end, and I will reveal what that question most likely is and provide an answer. If this is your first time here, my name is Betsy Wessinger, and I am a family recovery addiction coach. However, my expertise in this field comes from my life experiences as I fought the battle of my life to keep my daughter alive and bring her back from addiction. I want to share what I learned and our experiences with those of you out there who are currently fighting this battle. And I want you to know that you are not alone, and I can help you. Today, we are diving right into the topic of Recovery Capital. Do you know what it is? Well, Recovery Capital is a unique addiction treatment system that helps patients achieve and sustain recovery. Traditionally, addiction treatment has centered around intervention and abstaining. Treatment programs have mostly focused on one outcome, and that outcome is the lack of use of a substance. However, those familiar with addiction know that the struggle with drugs does not have a single outcome. It's not that cut and dry. Instead, substance abuse and sobriety are marked by a lifelong series of outcomes in an individual's life. Patients and providers alike have argued that a weakness in conventional addiction treatment philosophies and practices is the inability to account for the complex and individualized journey of addiction and recovery. One of the best examples of a recovery-based focus in addiction treatment is a concept called recovery capital. This concept was developed and introduced by Robert Granfield and William Cloud back in 1999. Recovery capital takes into account every facet of an individual's life that can either support or obstruct recovery. It's a systematic and way to address the degree and quality of the forces in life that help someone enter and sustain recovery. In economic terms, someone's recovery capital is the sum of all the internal and external resources available to them to sustain their recovery. For example, if someone has health insurance and access to transportation, then those are two resources that can contribute to their recovery. Simply put, the system is designed to uncover someone's motivations to stay clean, identify triggers that do the opposite, and then track them for better performance or handling of those factors. The recovery capital system it consists of 3 tiers. The first tier being personal recovery capital, and this includes physical health, health insurance, financial assets, shelter, food, clothing, and access to transportation. Human capital, also under this tier, describes more intangible aspects like values, knowledge, vocational skills, sense of meaning and purpose in life, perception of the past, present, and future, capacity for problem solving. The second tier is family and social recovery capital. And this is all about relationships, specifically the intimate family and social relationships that are supportive of an individual's recovery. And before I go to the third tier, I want to say that my daughter has told me time after time that this was one of the most important things that I did for her during her addiction, is that I was always there for her, and I was always supportive of her. I always let her know how much I loved her, and I never gave up on her. Okay, the third tier is community recovery capital. And these resources consist of external forces in one's environment that can support their recovery. This includes the attitudes, the policies, and the resources related to addiction and recovery within one's community. Ideally, all 3 aspects, personal, family, and community, consider drug and alcohol problems with compassion and actively promote their resolution. And I want to say that if you've ever watched any of my videos, you know that I believe that the Courage Center, the my local community recovery organization that I reached out to in the late stages of my daughter's addiction, I believe that they saved my daughter's life, and I know that they saved my sanity. So don't wait, and don't wait. Do it today. Don't be stubborn or ashamed like I was to ask for help. You will be so glad that you did. Okay, so recovery capital is a much more dynamic addiction treatment method than traditional abstinence. In a broad sense, recovery capital puts a huge emphasis not only on achieving recovery, but maintaining it as well. This system recognizes all of the factors that make simple abstinence so challenging to change emotional distress and pressures to use within relationships. It's a constructive and trackable way to navigate and manage recovery and the risk of relapse. And now the question that each and every one of you needs the answer to: how do I quit? Well, sadly, there is no one-size-fits-all answer when it comes to addiction and recovery. But there is hope on the horizon. With advancements in understanding and approaches like Recovery Capital, the treatment for addiction is becoming more personalized and effective. Individuals and their families no longer have to feel the shame and judgment that have become the norm in our society. You are not alone. And my daughter is living proof that recovery is possible. Remember, recovery is a journey and not a destination. Stay strong, seek support, and never, never give up.